Meningitis is actually a group of several viruses and bacteria that cause a group of symptoms we call meningitis, which is a stiff neck and associated other symptoms. In Nigeria, over the past few years, we've had large outbreaks of what has predominantly been caused by a bacteria called meningitis A, for which there's a good vaccine available. We had large campaigns that more or less eradicated Men A, but subsequently other types of that bacteria, last recently Men C, have become prominent, for which there's no vaccine available. So we're stuck with other measures that we keep to prevent, keeping your houses ventilated, early detection for treatment, but none of those are as effective as a vaccine. So until we have a vaccine that covers all the viruses and bacteria that can cause meningitis, we are left with the situation of recurrent outbreaks, and the best we can do is to detect them early and try and respond as early as possible. So following the large outbreak last year, this year we really started earlier, working with people in the state and local government levels and really educating them on the signs and symptoms of meningitis so they can present early to their healthcare facilities, and we have the opportunity of taking a CSF sample, which is what you need to make the diagnosis. We've done that very effectively this year, made sure we got a lot more CSFs, be able to offer them treatment early, and in a way, thanks to that, really prevented an outbreak as large as the one we had last year. We've still had a number of cases, but because of the early detection and early response, and as well as some other environmental factors, we've prevented a large outbreak like we saw last year. So actually there is a vaccine that covers 4 serogroups. The challenge is that the vaccine available at the moment is extremely expensive and completely out of reach of what we can afford as a public health organization in Nigeria and as a country. So what we're doing together with lots of other partners is really driving advocacy for a more affordable vaccine for the African continent. Those efforts are ongoing. We hope to have a vaccine in the next 3-4 years. While working towards that, we have to continue relying on other public health control measures available to us. The ideal scenario would be to have a vaccine that we can introduce into the routine immunization schedule and offer people the ideal preventive measure to prevent large outbreaks of meningitis from happening. So ahead of every meningitis season, what we do is work intensively with state governments across 3 different areas: in prevention, early detection, and early response. So together with every state in the meningitis belt, we put together a meningitis preparedness plan. In terms of prevention, developed jingles, local messages that were used in the states and local governments. In terms of early detection, made sure that there's a lab with the capacity to detect cases early and make sure they had the reagents to do that. And in terms of treatment, made sure they had ceftriaxone, which is the treatment of choice for cases, and made sure they had treatment facilities available. In the middle of all of that is the coordination efforts that need to happen, which is what we offer at the Nigeria Center for Disease Control, make sure that all parts of the chain of response are able to work together to make sure that we protect our people from this disease called meningitis. I think it's important for Nigerians to keep raising awareness around meningitis. Join us as we raise our voices. This is really a disease that many aspects of society will need to respond to. We all have our role. Every individual has a role to play. Healthcare workers have their role to play. The Nigeria Center for Disease has its role to play. And if we work together, we will be able to prevent most cases. We may not be able to prevent all at the moment, but prevent most cases and definitely prevent most deaths from meningitis from happening.